By show of hands, how many of you here are easily distracted or have the attention span of, that's a goldfish? Those of you who looked definitely have ADHD. No, I'm just kidding. But this is how it works. Often people are self-diagnosed and begin to self-medicate. So often, in fact, that most doctors require a checkup every 2 to 3 months to order or refill a prescription to treat ADHD. Although ADHD can be there your entire life without being diagnosed, it can be very disruptive to your daily life and your working life. Things you need to know about this disorder are its effects, diagnosis process, and fixes. I will begin by telling you the effects ADHD has on those dealing with this disorder. ADHD affects more than your attention span and hyperactivity. ADHD is a problem caused by the presence of 1 or 3 of these findings: not being able to focus, being overactive, and or not being able to control your own behavior. It can also be referred to as ADD or hyperkinesis. And while signs and symptoms can be hard to spot in adults, core symptoms typically start earlier in life, around age 11. ADHD affects people's sleep cycles, relationships, attention span, and focus, hyperactivity, and impulsivity. For me, my sleep cycle suffers if I don't regularly take my Adderall because I can't quiet my mind enough to drift off to the dream world. Paying attention to detail, having a good memory, and not interrupting are all the building blocks for a great relationship and good communication. Lacking these abilities are also telltale signs of ADHD. Now that we know what ADHD is and what the symptoms are, we can start to understand the diagnosis process. The diagnosis process is a long and tedious one. There's much work that goes into identifying and diagnosing someone with ADHD. Firstly, you must identify that there is a medical issue. This is especially difficult to do for adults, as I mentioned earlier, as the symptoms can be hard to recognize. Then you need to rule out the possibility that you aren't looking at some other condition, as there are many that resemble ADHD. To put it simply, other medical issues which prohibit thinking or behavior may cause symptoms similar to those of ADHD and therefore lead to a misdiagnosis. Among these issues are developmental orders, sleep disorders, and even brain injuries, just to list a few. There are many steps to being officially diagnosed with this disorder. No single test can confirm a diagnosis. The official diagnosis process includes the following: a physical exam to be sure of those other medical issues, gathering data from previous doctor's visits, family medical history, and a brief overview of the history of your symptoms, and lastly, a series of psychological tests to evaluate all of your symptoms. Now that we understand what ADHD is and what the diagnosis process is like, as you can see, doing nothing about this disorder will just cause you problems with relationships, school, and jobs. Imagine with me a world where it's possible to maintain a healthy relationship without communication, maintain good grades without a good memory and no focus, and a good job without being able to sit still or control your own behavior. You didn't imagine this world, did you? I know so many people with ADHD and amazing grades and great relationships, but how do they do it? They get treatment. There are typically 2 treatments available for ADHD: counseling or therapy, and medicinal relief. The type of therapy used in treating ADHD is called behavioral therapy, which is an umbrella term for therapies that treat mental health disorders. This type of therapy functions on the idea that all behavior is learned behavior and can therefore be fixed. This therapy will help you, the sufferer, determine what symptoms cause the most trouble in your life and how to fix them effectively. The other treatment option is, of course, medicine. These include stimulants and other. Stimulants meaning methylphenidates or amphetamines. I take the latter, known as Adderall. Stimulants will boost neurotransmitters. Neurotransmitters carry messages from the brain to the body and vice versa. To put it in simpler terms, stimulants rebalance the body, sleep cycle, appetite, heart rate, and mood. The other refers to non-stimulants and antidepressants, which balance the feel-good chemicals in the brain. I also take an antidepressant called sertraline. Now we know all what ADHD is, the diagnosis process, and how to treat it. ADHD isn't just having a short attention span and lots of energy. It is a mental disorder which changes the way a person functions entirely. Studies have even shown that the person with ADHD and a person without have different brains and different chemicals being active in the brain. This disorder affects many successful people and should not be looked at as a hindrance, but as a different way of thinking and living. So, after hearing all of this, how many of you feel confident enough to diagnose someone? Because I know I do. Thank you.